you all. As you all know, International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and homeopathic doctors. All these things started during the time of pandemic. There was not. It was an opportunity for connecting between doctors in and around the world who are practicing homeopathy, as well as we were able to collect all the details about the COVID in those times, and that really become a big event, and lots of presentations from different more than 65 countries. Doctors from 65 countries presented papers in this session. And today we are lucky to have a wonderful guest in Dr. SIDHARTH SAURABH. Sir has completed his MD and then now doing a PhD. He's a PhD scholar. He's working as the HOD and Department of Repertory, Ahmedabad Homeopathic Medical College, Gujarat, Pearl University. He has 15 years of clinical experience and 12 years of teaching experience. He has come. He has held different positions even now. Postgraduate. He is working as a postgraduate grade in Pearl University, UG and PG examiner, a subject expert, paper setter, chairman research committee, manage accreditation and maintenance process of NABH and NSC, and develop strategic plans to improve the academic programs and outcomes. And he has so many presentations and publications in various homeopathic journal, as well as in homeopathic uh, uh, seminars. So there are a lot of things to be there. I'm not going to elaborate all those things, but let us discuss. Sir is going to discuss a repertorial approach in pediatric cases. As you all know, a lot of cases are coming into the kitty of homeopathic doctors in connection with the pediatric. Most of the homeopathic doctors are known as pediatrician in the beginning, but as they get the momentum going, then they get chronic diseases and they will reach in the top level of some other ways, even become an expert in cancer or some other lifestyle diseases or whatever may be. So let us begin the session. We proudly welcome our guest of the day, Professor Dr. SIDHARTH SAURABH. Welcome, sir.
Thank you, Dinesh sir. First of all, I am thankful to Sani sir for giving this platform. As sir has said that I am chairing the research committee of Ahmedabad Homeopathic Medical College. So nowadays the scenario of homeopathy is slowly graduating to the research. Research is a big field nowadays, and if we need to update ourselves, we need to go with the research. Recently held WHD in Delhi is also emphasized over research in homeopathy. So I will start my presentation with the way we researchers think. So I will allow me to share.
Okay, it's really, really, it's okay. It's
So
fine.
first we will start with the presentation. As we say, this is repertorial approach in pediatric cases. So first of all, whenever we start with a topic in a research activity or in a thesis or in a research project, first we need to know what is the importance of the topic which we are going to start, which we are going to work upon. So if we talk about the pediatrics, this is a medical branch that deals with the care of children and adolescents. The terms come from a Greek word, as we all know that many of the medical words come from the Greek. So it's the Greek word pediopes, which means a child, and iatris, which means healer. The word pediatrics comes from these Greek words. So it basically deals with the problems of individuals from newborn cases up till 15 to 16 years of age, which is the adolescent age. And the recent data suggest that the population of children under the age of 15 years comprises of almost 35.3% in India. That's a huge population, and that's why it becomes important to work upon that age group. Secondly, if we talk about the role of homeopathy in these kind of cases, we are popular amongst the masses as a safe way to deal with the diseases. It's a safe, it's a very gentle way of treating the diseases. So I would like to divide my whole topic into three parts. First, we will talk about a little bit about homeopathy. Then we will talk a little bit about pediatric problems. And then we will talk about how to take the case and how to approach the pediatric case taking, which will include the repertorial approach also. So if we divide the nomenclature of pediatric age groups, so we have got newborns, which are from birth to 1 month, exactly 28 days, which we say it's a newborns or the neonates. Then we have got infants from 1 month to 12 months. Then we have got toddlers from 1 year to 2 to 3 years. Then preschool age, which is 3 to 5 years or 6 years. Then school age, which is from 5 years to 11 or 12 years. Then the adolescent age, which is 12 to 15 or 16 years, or sometimes we can say till the teenage. So the problems of each age group is different, and problems should be treated as per the age group. And as we all know that homeopathy is a gentle way of treating, so it is very good way of pathy for the child or pediatric age group. So now we will start with the discussion over homeopathy. So homeopathy is a form of complementary and alternative medicine which is considered to be safe and effective form of treatment for children and adults both. Children are also the frequent visitors for homeopathic consultation, as we all know that the masses know that homeopathy is a gentle art of healing. There is no side effects. So they want to treat their children with the medicines which are gentle, which has no side effects. Secondly, the way of prescribing the homeopathic medicines are such that children are very readily take the homeopathic medicines, as they are not very keen to take the bad taste syrups or the pills, or they doesn't want to have the injections. So at that time, it becomes very easy for the parents to go to a homeopathic physician and consult for the problems of their children. Homeopathy is an individualistic science, and this makes us special, as the need of every child can be different. The way children present themselves can be very different, and each case is different from other. So homeopathy works wonders when we treat the child from very early, and that can prevent a children from having the chronic complaints. So it can lead us a good adult life if we start homeopathy from the very early age for the children's. Now we will talk about the repertory and its role in homeopathic practice in general. So basically, when Dr. Hahnemann started practicing, so he find that there is certain difficulties when we are dealing with the patients, as it is not very easy to select the simillimum only with the help of materia medica, because there are so many symptoms of provings which are accumulated till that time, that he found that there should be a need of index which can help us to find the simillimum. And the answer was the index, or answer was the repertory. So repertory is basically a systematic and fundamental tool which can help us to find the simillimum. As we all know that homeopathic principles is like cures like, or similia similibus curantur. So it were very necessary that we need to match the symptoms of the patient with the symptoms of the remedy, which is the simillimum. And it is not an easy task for a human being to remember all the symptoms which comes on the proving or the clinical symptoms in our materia medica. So we need an index which can help us to reach that simillimum. So repertory can serve the basic purpose of finding the simillimum, that is selection, and the elimination of any remedy which is similar looking. So we need one remedy only. There should be one similimum only. So repertory is that bridge between the materia medica and the case. So it serves as a comprehensive reference guide which organizes the symptom based on their similarity to the various homeopathic remedies. As I have already discussed, that the first repertory was prepared by Dr. Henneman itself in early as 1805. But that was very initial attempt to form an index. But the main work which was done by Dr. Bonning Hussain in the preparation of repertories, which come up with a concrete plan of the repertories. Later on, there are various repertories which came up according to the need of the homeopathy. And there are various ways, various philosophical backgrounds upon which a structural plan was defined in the repertories, like Kant's repertories, Boric and Clark's repertory, which are clinical in diagnostics, then Bogart's repertory, which deals more in pathological and general symptoms. Now I come to the point how to practically approach when we do the repertorial approach. First things first, that the main thing when we were using the repertorial approach is the case taking. The case taking becomes a key to the repertorial approach because repertory needs data which can be analyzed. That raw data came from the case taking, and there is a rule in repertory which was said by Dr. Jugal Kishore that garbage in, garbage out. So whenever we are using a repertory, we should be very careful to feed a very good data to the repertory. That good data comes from the case taking. So the primary role of a physician is to collect a good data, and then we go for the symptom analysis. So this is the symptom analysis, which is the primary role in repertorial approaches, which we need to collect information about the patient's physical, emotional, and mental symptoms, then which can be later on go to the repertorial analysis. Then comes the remedy selection. So the remedy selection is basically the selection of a similimum, which I have already discussed, is the similar match to the patient's symptoms, which can be done according to the totality of symptoms. Now, this totality of symptoms can be different according to the different situation, according to the different patients, according to the need of the hour, which we want to, how we want to prescribe our remedy. The repertorial approach always go with the totality of the patient symptoms or the totality. Then we need to form a repertorial totality as per the need or which repertory we are going to use. Then comes the case management. After giving the remedy or after selecting the similimum, our work is not over. We need to discuss or we need to select the potency. We need to know how much repetition we need to do. Apart from these things, repertory can also help us in research and education. It is helpful in studying the materia medica. It's an indispensable tool in homeopathic practice, which is empowering homeopaths to analyze symptoms, selecting remedies, and managing the cases effectively. Now we come to the pediatric parts. What are the various common problems in pediatric age groups? The most common one is the recurrent upper respiratory tract infection. Nowadays, we are dealing with the scarlet fever, where patients are coming with the complaints of nasal obstruction, where patients are coming with pharyngitis. There is peeling of the skin. There is they present with common cold and cough, but it is more than that. And apart from that, there is a problem of decreased immunity, which causes the recurrent upper respiratory tract infections. Then we have got worm infestation. When we have got hematological disorder, mostly the deficiency problems. Then the skin disorders at the very early age, if the sora is active, there are skin disorders. Then we can have hives and disorders of pigmentation. One of the major areas which we homeopaths can work in pediatric age group is social and behavioral problems. Post-COVID, we see that there is a delayed speech in the children or in the age group which are born in the lockdown era, because they are very less exposed to the societies, and we are seeing the delayed speech. There are social problems and behavioral problems in those patients. Apart from them, there is an examination funk, gadget dependency. Children are nowadays very much dependent on screen. They are with their mobiles. They are eating only when watching the mobiles. Then there are attention deficit hyperactive syndromes. So these can be the areas on which homeopathy can work wonders. Apart from that, we have got delayed bile stones, dentitional diarrheas, dentitional troubles. We have got delayed walking, delayed speech. Constipation is again a very, very common disorder in preschool children and school age going children due to the dietary problems with the lifestyle which we are leading nowadays. Then there are few symptoms which are central nervous problems like seizures and epilepsies, in which we can have the scope of homeopathy. Now comes a very important topic, that is case taking approach in pediatric age group. How to deal when we have a kid and how to take a case in a pediatric age group. Now, why case taking becomes very important? Because whenever we are talking about the repertorial approach, one question which comes to the mind of every homeopath, every student of homeopath, is that how we can select the rubrics from the patient's language. Now, it's not an easy task. It comes from the practice and it comes from the way you are taking your case. If we take case thoroughly and wholly, if we are taking the raw data clearly, then only we can go to the repertory with a clear mindset. Then only we can go through the repertory with proper rubrics and proper symptoms. Now, what can be the prerequisites when we are taking a pediatric case taking? So, first prerequisite for a physician, that he should be soft spoken. We should approach child with a smiling face, with gentle manner, and we should try to build a good rapport with the children before questioning or examining. There should be some variability when we are dealing with children of different age groups. When child is neonate, then we need to be very much friendly to a mother and parents, because they are anxious when they are coming to the physician. Their child is already unwell. They are not very much in a mood of listening too much of the physician's talks. They are very much anxious. So it is needed that we need to mellow them down. We need to understand their complaints. Then comes the school age going children or the toddlers. Observation becomes very important when we are dealing with children of the age group which are toddlers, which are 2 to 3 years or 5 years of age, preschool children, how they are behaving, how they are, what are they are doing in the clinic, whether they are shy or whether they are restless, whether they are social, whether they are talking or not, whether they are how they are behaving in with their parents. Then we can ask the parents about child's behavior, how they are eating, how they are doing in their schools, how they are doing with their peers. How this is how we can know about the personality of a child. Behavior is important because there are various rubrics and repertories which are purely objective, and the objective rubrics can only be used when a physician is very observant. How is child sitting, how he is answering, whether he is making eye contact or not, whether he is able to answer your question, and if he is answering your question, how he is answering your question, he is incoherent or he is repeating your question. So these are the few things which we can observe while taking the case of a child. Then after that, we can make a picture of a child's problem, which includes his chief complaints, what they are coming for, then what are their general symptoms, what they are eating, what they likes, what they don't like, how they play with the other children, whether they are quarrelsome or whether they are shy, how they behave in front of strangers. So these are the things which can be observable in a pediatric age group patients. Then we come to a age group, a certain age group when the patient reaches teenage. In teenager children, it becomes very difficult to question them in front of their parents. They may not always be truthful. So we may need to question the child and the parents separately so that we can know what the child doesn't want to share their feelings in front of their parents. Then there are something which parent cannot talk about in front of their child. So there may be a need as per the age of the child. So in nutshell, homeopath must adopt a specialized approach to pediatric cases, focusing on careful observation, gentle communication, and holistic understanding of the child's physical, emotional, and mental health. Children present unique challenges and considerations in homeopathic practice due to their developing physiology, limited ability to articulate symptoms, and susceptibility to environmental influences. So these are the key points which we need to consider in pediatric case taking. First is observation and communication. See, observation, as I already talked about, that observation becomes very important in pediatric age group. When the age group where child is not able to speak, it is only with the observation in with which we can observe and find the symptoms. There are incidences where a patient came with a pain, the child is crying and nobody is able to understand why the patient is crying, why the child is crying. And this becomes very important, and we need to observe what can be the reason why the child is crying. The most commonest thing, reasons for a child to cry is that when they are hungry, they are having some kind of pain, when there is their sleep is not complete, when they have got some kind of irritation on their skin, then these are the reasons when a child can cry. So it is very important to examine that at that time, that how and why child is crying. So observation becomes very important. How children is responding to the stimulus. Communication with the parents is very necessary. We need to assure the parents that how what is the problem of their child, how we can going to manage the complaints of his children. Then lifestyle factors, as we have already talked, that the constipation has become a very big problem in the children, school age going children, because of the lifestyle which we are living nowadays. Lifestyle becomes very important nowadays. We have got fast food, we have got chips, we have got maida, we have got pizzas, burgers, and the patients are complaining of constipation. So it is very difficult to tell the parents that it need to be stopped. Parents always complain, हमारा बच्चा खाता नहीं है, or that he is always hungry, his appetite is not good, he doesn't have the hunger. But we need to understand whether the child has got less appetite, or whether his choice of food is not good. He is able to eat a good portion of pizza, but he is not able to eat the roti or chapati. That doesn't mean that his appetite is not good. That means that his lifestyle is not good, and that need to be changed. What he is eating is very important to see why the complaints are having. The problem of deficiencies come from the lifestyles only. So lifestyle becomes very important even in pediatric age group. Parental dynamics, whether the parental dynamics plays role when the children reach a certain age. whether they feel peer pressure of having something, then they are becomes irritable with their parents when their demands are not met, how parents are uh, dealing their tantrums, that becomes very important to understand, and becomes very important when we are counseling the parents for their children's complaints. Developmental life, how the patients develop, how the development is happening, or we need to understand the past history of the patient, of the children. What is the birth history, whether there is any birth complaints which was there, what was the mother's histories at the time of pregnancy, that was all come under the developmental life. How was their how was the child's milestones, whether teething were okay or not, whether the speech was at the right time or not, whether the walking was at the right time or not. And everything is important to understand when we are going for a repertorial approach, because only then we are going to find the rubrics from the repertories which we are at our hand. Psychological factors, changing times gives the changing psychologies. Child nowadays doesn't think like we used to think at our times. So we need to be updated that what's going on in a child's life nowadays, what's the peer pressure nowadays, how is the school, how are they dealing with the schools nowadays. So these becomes very important when we are dealing with a child's complaints. And this is the integrated approach which we need to take when we are going with the repertorial approach in a child's case. So in nutshell, if we understand, we need to take age appropriate language with the patient or with the child. Communication techniques need to be according to the age specific children. We need to talk about cartoons with the child, which was that age group, the preschool age group. We need to talk about the gadgets with a teenager. We need to talk about the friendships. We need to talk about how they are living, what are their hobbies to a teenager. Then we need to understand the family dynamics, whether they are living in a joint family, whether they are living with the working parents and they are only with the nanny at their home, whether they are feeling alone at the home. So this comes under child's dynamic, family dynamics. Nowadays, we see that both the parents are working and the child is feeling alone. So how the parents are dealing with a child who is alone at home, how they are eating, whether they are only dependent upon the fast food which are at their disposal at home. So these all are very necessary to understand. So what is the family dynamics of a patient? Any stressor or disruption in the home environment, whether they are shifted from a city to a new city. So these are the very common things which we need to understand the child's problems. Bedwetting is a very common problem in a pediatric age group. So one common reason for bedwetting is worm infestation, but the other one is psychological problems. Many times we see that there is no apparent problem with the child, but he's still having nocturnal aneurysm. And when we go deep inside, we say that this is a nervous temperament. There is some trouble in the school which is going on, and he is having these kinds of problems. These are necessary to understand, because till then we are not going to resolve these problems. They are going to trouble the child. Then evaluate the child's diet, sleep habits, his physical routine, and then his exposure to the environment. Developmental stage and milestone. Age-related concerns such as teething trouble in the growing age group, growth spurts. Nowadays, precarious menstruation is very common, and we have got good rubrics in repertories for precarious menstruation. So these are the growth spurts. When we see that pubertal age groups, there are certain kinds of changes in physical and behavioral changes of teenagers or in pubertal age group that need to be understandable. So the last part of our counseling and case taking is that we need to educate parents about homeopathic principle what are their treatment options, what are scope of homeopathy for the complaints for which they have came to us, how we can help the child's health and with the homeopathy, and what is their role in the development of child and its health. So when we come to the repertorial part, in pediatric cases, selecting the appropriate rubrics from the repertory is crucial for accurately capturing the child's unique symptoms and guiding the selection of the most suitable homeopathic remedy. And this unique appropriate rubric came from the case taking. So case taking is again very important because repertorial approach comes from the case taking. There are certain repertories like Murphy's repertory, which has a whole chapter children, in which we have got various kinds of rubrics with the help of repertory, which is very helpful while selecting our remedies. But the thing is, we need to understand that case taking becomes very crucial, because if we are failed to capture the problem of a child, we fail to capture the essence of the case taking. Finding the rubrics becomes very difficult job for us. So how to start with the repertorial approach after taking the case? First of all, we need to list down all the symptoms of the patient, and we need to analyze them, that what are important symptoms on which we need to work. Okay? So we need to prioritize the key symptoms on which we need to work. There should be an analysis and evaluation of symptoms for the selection of repertory. Canned repertory can be helpful when we have got good psychological factors, when we have good general symptoms. We can always go for a clinical repertory if we have got only clinical symptoms, only we are dealing with some kind of one-sided diseases. We can go with the comprehensive, the new repertories if we have got a big complicated case, which we can go with the help of the new repertories. Thus, a repertorial approach should be done in the cases for the selection and to know the group of remedies. Now, I am going to present certain rubrics present in different repertories. First, we go with the Murphy repertory. See, Murphy repertory is a repertory which is very modern, which is comprehensive, which deals clinical as well as classical cases, and which gives us very new terminologies also. One specialty of Murphy repertory is that it has a chapter children, or the rubrics of mainly various kinds of rubrics related to pediatric age group we can find in this chapter apart from the other chapters. So we can have a glance to these rubrics. Children in general, agar constitutionally we want to see what kind of remedies which are helpful in the complaints of children. This is children in general. We want to go alphabetically, as it's an alphabetical repertory. Adenoids, angry children, anxious children, asphyxia infants. Now this is the infant problem. When we have got asphyxia neonatorum, this is asphyxia infants. Children asthma. See, we had talked about, when we are talking about the common problems, we have talked about the upper respiratory tract infection, but the lower respiratory tract infections are also very common in children. Asthma is one such complaint. As I have completed my PhD in asthma in pediatric age group, I want to give a brief about the asthma. See, asthma is a complaint which comes to a stimulus. It's a breathlessness to a certain stimulus, which is nowadays very common in pediatric age group. And the irony is that the allopathic system doesn't have a very concrete solution to the asthma problems. They always wait that the child reaches to a certain age. Till then, we can just manage its asthma, and till then, we can just manage it. It can go away on its own. But many a time it doesn't happen. It is very important that we give a good quality of life to the children. and the asthma or can give a very low quality of life to a children, in which he is losing his school, he is not able to play with his friends, he is not able to eat certain kind of things. And at that time, homeopathy comes to the rescue. In cases of allergies, when we are not able to identify certain allergens, the individualistic approach to the allergies or to the children becomes very important. And I have seen the results in the children of asthma, that the children who are taking 2 pumps a day, they have stopped taking pumps at all. I will be sharing a case with you at the end, but asthma is one field on which we need to work very hard. Autistic children, there is no treatment for autism in the allopathy. There is limited scope in homeopathy as well, but at least we can give a good quality of life to our children with autism. There are few cases, if we go to the studies, there are few incidences where autistic children can lead a good life after taking homeopathy, along with the behavioral therapies as well. Then there are few rubrics from the chapter children. Bashful, this we can observe while at our clinic. Bedwetting, as I have told, bedwetting becomes very common problem, but we need to understand why the bedwetting is happening. Infantile colic, very common in infants. Difficult concentration, behavioral problems in which we can help a lot. There is no treatment for concentration in allopathy in which we can help. Constipation in children. Constipation, again, lifestyle disorder nowadays. There is no other treatment in allopathy other than the laxatives, but with the help of homeopathy and certain lifestyle changes, we can treat the children with constipation. Convulsions, there is good role of convulsions in pediatric age group with homeopathy. Cough, recurrent cough. Then the rubrics are in alphabetical order from the repertory of from Murphy's repertory. And we can see cowardice, cruelties. These are the nature wise we can decide the remedies. Dentition difficult, nice, marvelous role of homeopathy in difficult dentition. Then this is synthesis repertory. Synthesis is again a very new repertory by Dr. Frederick Stoens. It is very much updated nowadays. New repertory purely and properly arranged as per the Kantian plan. And we can use this repertory extensively when we have got good rubrics, we have got new nomenclature, then we can use this rubric, this repertory. So these are the various rubrics which are present in synthesis repertory for the pediatric age group. So we can see children in. So there are so many rubrics in repertories, but we need to understand the case of a child. And we can always use the repertory towards fullest. Repertory is an ocean in which we need to find the gem. And these gems come when we dig deep into our case. Constipation. Kant's repertory is a good old repertory. It's the master repertory, we can say. The Kant was a master, our master, who has changed the way the homeopathy is practiced. So post-Kantian repertory, we always see that there is some kind of inspiration from Kant in the post-Kantian repertories. These are some rubrics from the Kant's repertory. Boric repertory is a clinical repertory, and clinical repertory or the Boric repertory can be used very successfully when we are dealing with very few symptoms. We want to see the clinical rubrics only. We have only very few symptoms. We are not able to find various symptoms. We need to give quick prescriptions. Then the Boric repertory can be very successfully used. Bonning-Hussain repertory is an old repertory, can be used in few cases when we don't find rubrics in many repertories. At that time, Bonning-Hussein's repertory can came to our aid. These are few rubrics from Boning-Hussein's repertory, which we can see Clark's repertory is again a repertory, clinical repertory. And the specialty of Clark's repertory is that it is only repertory apart from Murphy's repertory which have got the constitution rubric. So this is the chapter temperaments, children in general. So the various complaints of children, various remedies which are pertaining to the child age group with pediatric age group are given here with the various complaints the children's are dealing with. So this is the Clark repertory. Now I am going to share a case of a 7-year-old girl. This is from our SIDHARTH hospital. She is suffering from wheezing, coughing, shortness of breath since the age of 4 years. So she is suffering from 3 years with these complaints. And the complaints get exacerbated in the seasonal changes during damp weather, exposure to dust and strong smell. These are the common stimulus to which the child allergy is happening. So the episodes were accompanied by chest tightness, frequent nocturnal awakening due to breathing difficulties. Child's parents reported various incidences of hospitalization for asthma exacerbation in the past 2 years. So they always hospitalize her. They gave her various kinds of bronchodilators. At the time of consultation, she was on inhalation of quick-acting bronchodilators 2 to 3 times a day for the past 4 months. This is the most aggravating period of the child since last 3 years. So that the bronchodilators are able to give only temporary relief. The frequency of these inhalers has been increased in the last 2 weeks. So parents sought an alternative treatment approach due to concerns about the long-term use of bronchodilators and desire for a more holistic and individualized approach. So when we see the medical history, apart from the chief complaints which we have, so other complaints which or other symptoms which we have noted down is that she is a light colored hairs, she is little bit ill-tempered and very stubborn and shouts and cries loudly if refused some demand. Parents reported that they are vegetarian and her appetite is good. She is fond of sweets, drinks lots of water daily and perspires profusely, especially in her head, face and neck. See, these complaints, these symptoms are very important. These general features are very important when we are dealing a patient holistically. Because the chief, only according to the chief complaint, there can be very few remedies if we want to give therapeutically. But we will take the good case, we have got the good general symptoms, then we can give a holistic treatment. So she always wants to play and likes to have someone with her all the time. So she wants company at times. Her concentration is poor and she is not much interested in studies. So we have taken these totality of symptoms: obstinate, difficult concentration, fear of being alone, playful, anger, desire for company, contradiction intolerant, desire sweets, profuse perspiration, thirst for large quantities of water. And the case was repertorized with the help of Synergy homeopathic software. And we can see that we have got lycopodium, bryannia, phosphorus, conium, aconite in the leading remedies. You must have noticed that we have left out the symptoms of asthma from the repertorial totality. I want to add on, we can add as many as symptoms we want in the repertory, but that doesn't give us the accurate result. We need to understand on what basis we want to give the remedy. We want to prescribe a good constitutional remedy to the child, which also covers the chief complaints, which were taken into potential differential field. So these are the group of remedies on which we can work out with the help of Materia Medica, and we came up with Bryannia alba. Bryannia was selected with the following considerations and symptom similarity on consulting homeopathic materia medica. So when we go to the materia medica, we find the bryonia patients are ill-tempered, effects of anger, ill effects of anger and fright, cough at night, must sit up, thirst for large quantity of water. Bryonia works nicely for difficult respiration, ailments from sudden change in weather, draft of air. I just want to give back to a few slides. So when we gave her Bryonia alba 30 CH and placebo was given for every 2 hourly for 3 days. The result was very good. I haven't shown the result over here, but the results were good. And we find that she slowly get rid of her bronchodilators and she was totally well within 3 months of the treatment. So we have to continue with the treatment and we have to keep her in follow-up for any exacerbations of the complaints. But she is now rid of the bronchodilators, which was constant, which she was constantly taking 2 to 3 times a day. So this was the case, but I again want to say that the repertorial approach depends solely upon the case taking. And if we take a good case, then we can always have the ocean of repertories with which we can dive deeper and found a good gem in the form of similimum. So this was from my side. Thank you. Thank you to listen to me.
Yes, sorry. Really, an excellent session, Dr. Siddharth Agarwal, sir.
Thank
It's
you, sir. Thank you, sir.
we must say that we all of us are treating pediatric cases, but definitely, if you the relevance or importance of case taking is more important than the clinical the other the so-called diagnostic point of views. And as you rightly point out, that the well taken case is half cured, and this shows the beauty of homeopathy. And of course, when a child enters, you can see different type of children coming into the clinic and doing it. Some used to dance, some used to sing, some used to abuse, some used to hit, and some used to run here and there. So all these things can even all these things alone can reach us to the similar even before we ask the question, what is your case? That's when you are an expert in homeopathic materia medica as well as in observing the patient. Definitely, when you grow up, you can choose the remedy from the very first minutes itself in that way, and that is what is homeopathy is all about. That means that what is rare in a patient is more important than what is the case itself. So if you observe the patient, that is the child, what he shows in front of you is what is rare in the patient, and that will definitely end up in finding the right simile in the shortest possible time, and that will help you to choose the remedy, and that will definitely relieve the patient. Not only relieve the patient, cure the patient. And as you point that, yes, sir, as you point out here that the in the asthma case also, some people say that I'm having allergy from this and that, but actually it is not the allergy that produces the disease, but the fact is behind the case. I still remember a case of an asthma case when a child was brought to the clinic and the child was doing the whatever things he can do, that much of I think he was taking my stethoscope, running away with it, and he is destroying all the papers in front of the in the visiting room. All those were disturbing. So I just give him a dose of medicine, and then I just asked the question about all those things. What I found that the child was having asthma, and they took the child to different hospital, and they were admitting the child in different hospital, but still the patient is in agony and the patient is suffering day by day. And that is what happens with that kind of treatment when after because of the treatment, the parents become bankrupt, and they one day the mother and the child was trying to they are going for just suicide in front of a railway track. But some people brought them to my clinic, and thereafter I took the case in detail, and within 6 months the child is perfectly all right, and thereafter the child was totally cured with the homeopathy. That's the beauty of homeopathy.
Yes.
Yes, sir. Anyway, it is the time for discussion. I invite all of you to participate in the discussion, and those who want to participate in the discussion can raise the hand, and so that we will allow you to unmute yourself and talk. Yes. Yes, sir. Rampari sir, you can begin the session.
Thank you, Ji. Congratulations, Dr. SIDHARTH Agrawal, sir.
Good evening, sir. Good evening.
Very nice presentation. Described pediatrics collecting of symptoms according to repertorial chart. Easily described. Repertorial chart, Murphy repertory, Clark repertory, Boric repertory, Murphy repertory, a beautiful repertory, alphabetically it and Boric, Clark repertory, constitutional repertory.
Sir, I want to add one
Very
more
nice.
thing. I'm sorry to disturb you, sir. I want to add one more thing. For the physician as senior as you, for the physician as experienced as you, at times using repertory is not always an option. You can always sideline the repertories if you want to. So it is not, I'm not saying this. I am not saying this. This is said by Dr. H.A. Roberts in Morning Hussein's repertory, that for an experienced physician, he can skip the repertorization process if he is very well experienced with the Medria Medicas. But still at times, if we are at your with your experience, at a times it may happen that you may find a little bit use of repertory if you come across a very good characteristic symptoms, as we talked about delayed walking. So if we see in Murphy's repertory, there are so many sub rubrics with delayed walking. So you can use some kind of rubrics at times with your experience also, sir.
Yes, sir. That's you are absolutely right, sir. That's why we say that homeopathy is an art as well as a science, and we have two type of prescription usually. One is the classical prescription, the other is artistic prescription. The artistic prescriber can definitely click the point as just I pointed out just before. You can definitely prescribe even without repertorization from your experience. But as a student, from the very beginning, you will have to go the rules. That is the scientific, taking the case in details, and then finding the symptoms, and then finding the exact rubric for the same, and then repertorization. Then you find the right remedy. Then you choose the potency, and that will definitely be the right method as far as a beginner, as well as when you have a lot of experience, then definitely you can go in that way. That's why we say that we can, an experienced doctor can go in that way. But even at times, you have to make sure that your medicine is correct. So in those circumstances, you will have to take the case. You will have to go for a repertory, even you are a senior doctor. That's what I would like to add to the session, sir. That's the beauty of our homeopathy. Sir, we hope that you can have some more presentation because your slides and presentations and everything were excellent. Because of lack of time, you just cut short the last part of the sessions, and of course you can come up with some of case presentation in the future also. So
Yes.
I invite, sir, please share your WhatsApp number so that we can contact you.
Yes, sir. I have.
Please share. Now I invite Dr. Bob Lim from Malaysia to say, no, before that, there was a doctor. So, Dr. Savi, you can talk to, please unmute yourself. Please. Yes.
Okay. Good evening. Thank you, Dr. Agrawal. It's very important for children case and observation and using the different repertoires is very, very wonderful session. Thank you so much.
Thank you.
And my experience is that the children's every time says your problems, sometimes show, sometimes says, and it is very important. Listen and listen and observation. All of the yours says all of that. Parents, children's problems, children's behavior, and says, thank you so much. I learned a lot of things, your session. Thank you so much.
Thank you.
And thank you so much, IFPH again.
Now it is up to Dr. Boglim to say vote of thanks to the session.
I thank you, Dr. Danesh.
Is there
On behalf of the International Forum for Promoting, this is the 1328 IFPH, and Dr. SIDHARTH has done a good job trying to explain from the very
as there is some network problem with Dr. Boglim. We before saying vote of thanks, tomorrow we will have a session from Dr. Leena Vasanchare, and she will be presenting on a subject which is current trend developments in healthcare and expectations from homeopaths. And so that will be the subject to be discussed. Thank you, Dr. SIDHARTH Agarwal, and those who participated in the session, and those who are joining the session also for the next session. Thank you all. Good night.
Thank you, sir. Thank you to IFPH for giving the platform and for the discussion. Thank you, sir.